Hello, I'm Dr. Sai Praveen, Neurologist at Akkineni Hospitals. Hope you are doing well. In this session, we'll discuss some crucial points. Stay attentive and make your notes.
All right, let's dive right into this explainer and completely shatter the myth that sleep is just passive downtime for your body. We're going to walk through the fascinating neurological dimensions of sleep, the hidden disorders that can completely derail it, and most importantly, exactly how we can manage them. So, what is your brain actually doing when you close your eyes at night? Well, rather than just shutting off or going into some kind of standby mode, your sleeping brain is actually engaging in a hyperactive, absolutely critical neurological process. This dictates your overall health. It's actively consolidating memories, repairing cellular damage, and fine-tuning your entire hormonal system. Now, a massive part of this is the glymphatic system. Think of it as your brain's dedicated overnight cleaning crew. It literally washes away the toxic metabolic waste that builds up while you're awake. And if chronic sleep disruption gets in the way of this clearance process, well, you're looking at some serious consequences, like impaired cognition, cardiovascular disease, immune suppression, and even metabolic dysfunction. But unfortunately, getting in the way of that overnight cleaning process is incredibly common. Globally, about 30% of adults suffer from sleep disturbances. But look at this. In urban India, that number surges to between 35 and 40%. This massive disruption is mostly driven by modern lifestyle factors. Shift work, environmental heat, and excessive screen time are just wreaking havoc on our natural neurological rhythms. Okay, moving on to the common culprits. Let's look at how mechanical failures and chemical disruptions sabotage our nights, specifically focusing on obstructive sleep apnea and chronic insomnia. So, obstructive sleep apnea, or OSA, is pretty much the most common serious sleep disorder out there, and it's a literal mechanical failure. Basically, your upper airway collapses during sleep. This literally starves the brain of oxygen, causing repeated breathing pauses and frequent micro-awakenings. Because your brain is essentially hitting the panic button to get air, you end up with loud snoring, morning headaches, and completely unrefreshing sleep. It leaves you just exhausted the next day. Right now, it affects 2 to 4% of middle-aged adults, and that number is steadily climbing right alongside obesity rates. The really crucial takeaway here is that OSA isn't just an annoying snoring problem. It's a profound systemic threat. Having untreated OSA drastically increases your risk of hypertension. In fact, half of all OSA patients have high blood pressure. It also spikes your risk for stroke, heart failure, and type 2 diabetes. And terrifyingly, because of that intense daytime exhaustion, it gives you an 8 times higher risk of being involved in a motor vehicle accident. Thankfully, this scary mechanical failure has a highly effective solution. Once a doctor confirms the diagnosis through an overnight sleep study, which is known as polysomnography, the absolute gold standard treatment is CPAP therapy. You can think of a CPAP machine as a gentle pneumatic splint. It provides continuous air pressure to keep that upper airway wide open, making sure your brain actually gets the oxygen it needs to do its nightly maintenance. On the flip side of that, we have insomnia. This is a chronic condition affecting 10 to 15% of adults. To officially be diagnosed, you're usually battling this at least 3 nights a week for 3 months or more. Now, unlike the physical airway collapse we see in OSA, insomnia is primarily driven by psychological factors. We're talking stress, anxiety, or depression. It can also be triggered by medical issues like GERD or even certain medications like SSRIs. And when it comes to treating insomnia, cognitive behavioral therapy, or CBTI, is the gold standard. It beats traditional sleeping pills every time because it actually fixes the root behavioral causes. You avoid the dangerous chemical dependencies and things like the increased risk of falls in the elderly that are highly associated with short-term chemical fixes like Z-drugs. Now, let's pivot from these common complaints to some truly fascinating anomalies in brain chemistry and circuitry, movement disorders, and narcolepsy. Let's start with restless leg syndrome, or RLS. This causes an irresistible, deeply uncomfortable sensation in the legs. If you've ever felt it, you know exactly what I mean. It's this profoundly disruptive, creepy, crawly sensation, especially at night. It interrupts sleep for 5 to 10% of adults. But here's the really cool neurological key. It is frequently driven by specific chemical deficits. It's often linked to an iron deficiency, which is why checking for ferritin levels under 75 is standard practice, or a dopamine deficiency. And once you identify that, it's highly treatable with iron supplements or low-dose dopamine medications. Another severe anomaly is narcolepsy. And listen, this is way more than just being tired. Narcolepsy happens when the brain mistakenly attacks its own wakefulness cells, specifically the hippocretin neurons. Losing these neurons triggers excessive daytime sleepiness, sleep paralysis, and something called cataplexy, which is a sudden muscle weakness usually brought on by experiencing strong emotions. That brings us to a frankly terrifying condition that serves as a literal window into the brain's future: REM sleep behavior disorder, or the dream enactor warning. To understand this disorder, we first need to understand muscle atonia. Normally, when you enter REM sleep, which is your active dreaming phase, your brain triggers a protective skeletal muscle paralysis. It literally keeps you still and safe in your bed. But in REM sleep behavior disorder, patients lose this protective muscle atonia. This means they physically and often violently act out their vivid dreams. They might be punching, kicking, or even falling right out of bed. Now, the reason this matters is absolutely staggering. Approximately 80% of patients with this disorder go on to develop conditions like Parkinson's disease or Lewy body dementia within 15 years. Acting out your dreams is what doctors call a prodromal marker. It is literally the single strongest early warning sign for these neurodegenerative diseases that we currently know of. So, to protect ourselves from these severe systemic damages, everything from airway collapse to cognitive decline, we've got to talk about the blueprint for restoration, the fundamentals of sleep hygiene.
You can immediately empower yourself by treating your bedroom like an absolute sanctuary. Consistency is your best friend here. Waking up at the exact same time every day anchors your brain. And here's the hard truth. You have got to banish screens an hour before bed, because that blue light literally tricks your brain into halting its melatonin production. Finally, skip the late-day espresso, and despite what you might have heard, a nightcap does not help you sleep. Alcohol severely shatters your natural sleep architecture.
Sleep disorders span from simple correctable hygiene issues all the way to complex hidden neurological threats. The source material from the neurology team at Akkineni Hospitals notes that comprehensive evaluations like polysomnography are absolutely crucial if you're struggling. I want to leave you with this final thought. Knowing that your brain uses those quiet hours in the dark to literally wash away toxins, rebuild your cells, and stave off debilitating diseases, can you really afford to ever treat your sleep as just passive downtime again?